Epinephrine Bristojet by Toni Imprescia and Dhara Shah. This video is going to demonstrate how to assemble an epinephrine Bristojet device. Epinephrine is a medication that may be needed during a medical emergency. We will assemble and draw up patient-specific doses from the epinephrine Bristojet device using a stopcock. At Boston Children's Hospital, each code cart is equipped with a codebook that has all the medication doses listed based on the patient's weight. For this video, we will use a weight of 30 kilograms to demonstrate drawing up epinephrine doses from an epinephrine 0.1 milligrams per milliliter Bristojet that may be needed during a cardiac arrest. Gather all your supplies, including the epinephrine Bristojet, needle, syringe, and a stopcock. The epinephrine Bristojet consists of two parts, a glass syringe that contains the drug and a plastic barrel that contains the needle. The first step is to remove the caps on both the glass syringe and the plastic barrel. Next, insert the glass syringe into the barrel without exerting excessive force. Ensure that the syringe and the barrel are properly aligned. Gently rotate the glass syringe clockwise, about 3 turns, until the medication enters the needle. Now, to access the medication through the Luer-lock adapter, remove the yellow cap by twisting it counterclockwise. Now, attach the 3-way stopcock on the Luer-lock adapter for the Bristojet syringe to enable drawing up multiple doses from a single syringe. Based on the codebook, a dose of 0.01 milligrams per kilogram is needed, which would be 0.3 milligrams or 3 milliliters for our 30 kilogram patient. Now attach a 10 milliliter IV syringe to the other end of the stopcock. Turn the dial of the stopcock to allow flow of epinephrine from the Bristojet to the IV syringe. Push the glass plunger slowly to transfer 3 milliliters of medication into the IV syringe. Cap the syringe and then label it with the pre-printed labels provided in each codebook. You may draw up multiple doses using this technique. Note that there are other medications available in a Bristojet device, such as dextrose 50%, sodium bicarbonate, and calcium chloride that can be assembled using the same technique.